All right, today we're going on a pretty wild journey, deep inside your own digestive system. We're going to unpack the incredible science behind all those common medications we use to manage it. From heartburn to indigestion, we are basically unlocking the secrets of your gut's very own pharmacy. But first, let me ask you something. What if I told you that the most powerful, most corrosive chemical you deal with every single day isn't sitting in some lab, but it's actually sloshing around inside your body right now? I'm talking about a chemical so strong it can dissolve metal, but at the same time it's so essential that you literally couldn't live without it. You guessed it, that chemical is hydrochloric acid, better known as your stomach acid, and it lives on an absolute knife's edge. So today we're going to look at the stomach's incredible balancing act, see what happens when that balance gets totally thrown off, and then check out the brilliant pharmacology that's been designed to put it all back together again. Okay, let's get into it. So our story really begins inside the stomach itself. And you have to think of it as a true chemical powerhouse. I mean, it's got to be strong enough to break down a steak, but also smart enough not to break down itself. And the way it pulls this off is through a really complex system of secretions. Inside your stomach, you've basically got this highly specialized team of cells, and each one has a critical job. The parietal cells, they're the heavy hitters, pumping out that powerful hydrochloric acid. Then you've got the chief cells, which release an enzyme to digest proteins. But here's the catch. It only gets activated by the acid. Now, to stop all this power from just, dissolving the stomach itself, mucus cells create this awesome protective barrier. And the conductor of this whole orchestra? That's the G cells, which release a hormone that tells everybody when it's time to get to work. So this all sets up a constant internal battle. On one side, you have the good guys, the protective factors, that mucus barrier, bicarbonate to neutralize acid, and these things called prostaglandins that keep the blood flowing and help with healing. But on the other side, you've got the aggressive factors, the acid and pepsin, of course, but also outside threats, like the H. pylori bacterium, and even common drugs like aspirin, which can actually shut down those helpful prostaglandins. So, what happens when this delicate balance is totally lost? Well, when the aggressive factors start to win, that protective lining can break down, and that leads to two very, very common conditions: peptic ulcers and acid reflux. A peptic ulcer is pretty much exactly what it sounds like. It is a literal hole in that protective wall. The acid and enzymes are no longer just digesting your food. They've actually started to digest the lining of your own stomach or small intestine, creating a really painful sore. Now, for the longest time, we all blamed ulcers on things like stress and spicy food. But it turns out the real culprit is often microscopic. It's kind of shocking, but in a staggering 90% of cases, the root cause is an infection from that one specific bacterium we just mentioned, H. pylori. Now, the other really common problem is GORD, or reflux. And this isn't about a breach in the stomach wall, it's more of a mechanical failure. There's a muscular valve at the top of your stomach, the lower esophageal sphincter, and sometimes it just loses its tone. This lets all that corrosive stomach stuff splash back up into the esophagus, which has none of the stomach's protection, and that's what causes that classic burning feeling we all know as heartburn. Okay, so the defenses are down, the system is totally out of whack. How do we fight back? This is where pharmacology gets really, really clever, with drugs that are designed not just to treat the symptoms, but to step right into the middle of this chemical battle. And the game plan usually falls into three main categories. First, you can put out the immediate fire by neutralizing the acid that's already there. Second, you can go straight to the source, to the factory, and tell it to slow down production. And third, you can actually help the body rebuild its own defensive walls. The first strategy is by far the simplest. Antacids are basically just alkaline salts. You can think of them like chemical firefighters. They just jump in there, react directly with the hydrochloric acid, and neutralize it. Now, this doesn't fix the underlying problem, but it gives you that fast, effective relief from the burn. Strategy 2 is a bit more sophisticated. Let's cut down acid at the source. H2 receptor antagonists work by blocking one of the key signals, histamine, that tells those parietal cells to make acid. It's like cutting one of the factory's communication lines. But the real heavyweights are the proton pump inhibitors, or PPIs. They don't just block a signal, they go right to the assembly line and physically shut down the microscopic pumps that secrete the acid in the first place. And the way PPIs are designed is just incredibly elegant. You take it as an inactive pill, it's what's called a prodrug, so it travels harmlessly through your body,
It only flips the on switch when it gets to the super acidic environment right next to the parietal cells. And once it's activated, it latches onto those proton pumps and shuts them down for good. I mean, the body actually has to build entirely new pumps to start making acid again. It is just so incredibly targeted.
And that brings us to our third strategy, reinforcing the stomach's own defenses. These are the fortress builders. Some drugs, like sucralfate, create a sort of protective bandage right over an ulcer, while others, like misoprostol, actively help the stomach by ramping up the production of that protective mucus and bicarbonate. Okay, so we have covered the acid battle pretty thoroughly. But the gut is so much more than just a bag of chemicals. It has this deep, deep connection to the brain. So let's pivot for a minute and tackle a totally different problem: nausea and vomiting. So here's the thing about nausea. It's not really a stomach problem. It's a brain problem. It's all controlled by two key areas in your brainstem. There's the vomiting center itself, and then there's this fascinating spot called the chemoreceptor trigger zone, or CTZ. Think of the CTZ as a surveillance hub. It's loaded with receptors for dopamine and serotonin, and it's also getting constant updates from your inner ear about motion, which, of course, is why you can get motion sickness. So what this means is that anti-nausea drugs, they're called antiemetics, they don't really do anything to your stomach. They work on your brain. You can think of them as signal jammers. They go in and block the specific dopamine, serotonin, or histamine receptors in the CTZ and the vomiting center, and they stop that nausea command from ever being sent out. Okay, finally, let's talk about the rhythm of the system, the traffic flow, if you will. Pharmacology can also help out when things are moving way too quickly or, well, not moving at all. We're talking about intestinal motility. So when things are moving too slowly, we often turn to laxatives. But as you can see, they're not all the same. They all solve the problem in very different ways. Some of them add bulk to kind of trick the system into moving naturally. Others use osmosis to draw water in and get things flowing. You can even directly stimulate the gut's nerves or, just lubricate the path. It's really about picking the right tool for the job. Now, what about when things are moving way too fast? This is where it gets a little counterintuitive, but it's really cool. The most common antidiarrheal drugs are actually related to opiates. And here's how they work. They actually increase the muscle tone of the intestine, but they decrease the propulsive, forward-pushing waves. It's this slowdown that gives the intestine more time to do its most important job: absorb water back into the body. But listen, before you reach for any drug to slow things down, there is one treatment that is the absolute #1 most critical priority in cases of severe diarrhea, and that is oral rehydration therapy. The biggest danger from diarrhea isn't the discomfort, it's the rapid loss of water and essential electrolytes. Replacing those is always the most critical first step. So as we wrap things up here, let's just zoom out and look at the big picture. The pharmacology of the gut isn't about brute force. It's not about overpowering the body. It's all about making these clever, really targeted interventions to help restore its natural balance, whether that means neutralizing acid, blocking signals for overproduction, helping rebuild defenses, or just recalibrating the whole rhythm of the system. We've seen that our gut is constantly talking, using this rich and complex language of hormones and nerves and chemicals. And we figured out how to develop drugs that can speak that language to help restore order, which really just leaves us with one final question. As we get better and better at listening in on this internal conversation, what other incredible secrets about our health is our gut going to reveal next? Thanks for tuning in.